Okay, Mr. Monroe.
Yes.
Nice to meet you. My name is Dr. Perez. I'm the resident orthodontist here.
Okay.
Today is your first visit to our clinic, is that right? I heard you just moved to the area.
Yep, I just moved here.
Well, welcome. It's very nice to meet you.
Thank you.
I have your electronic chart pulled up here, and there's just a couple demographic information that I need to confirm with you, if that's okay.
That's fine.
Perfect. Can I have you just spell out your last name for me?
Sure. Monroe.
And I have first name James.
Yep.
And you are a junior, correct?
Yes, I am.
Can you confirm your birthday for me?
Sure. January 17th, 1984.
Perfect. And I have your address as 789 Phillips Road.
Phillips Road? Yep.
Perfect. So tell me a little bit about your oral health. When is the last time you saw a dentist?
It's been more than a year, but less than 2 years.
Okay.
So I'm definitely due for my checkup.
Do you have a history of anything like cavities, braces?
No, I've only had one cavity never had braces. So pretty strong dental history.
Good. Do you know when the last time is that you had x-rays done?
No, I don't.
Maybe need those done today?
I think so, yes.
Okay, so we can have a look at that. Let's see. Okay, so no cavities, just the one. No braces. Okay, and are you experiencing any symptoms today, like pain, throbbing, jaw pain,
No.
any headaches that could be related to dental like symptoms?
No, I don't think so.
Nothing.
I'm feeling pretty good today.
Good. Glad to hear it.
Thank you.
Okay, so I think we are good to go as far as updating your chart. So I will get all of this submitted.
Okay.
I'm just going to have you sign for me.
Sure.
Perfect. Okay, well, thank you so much, James. Is it okay if I call you James?
Yeah, that's
okay.
fine.
I am going to go ahead and get ready. I'm going to gown up, get my gloves on. I will have you go back to the receptionist desk. Rachel will take you to get your x-rays done. It only takes a couple minutes, okay?
Okay.
Okay, so I'll meet you back in here, have you lay down, and we'll get started with the exam.
All right, sounds good.
All right, see you soon.
All right.
All right, James, welcome to the table.
Thank you.
I am going to go ahead and get you covered up here.
Okay.
Can I have you just lift your head for me? Perfect. Go ahead and relax. Is that comfortable for you?
Yes, it is.
And I'm going to get on a pair of sterile gloves here, and I'm just going to kind of use you as my table.
Okay.
Alrighty, let's go ahead and get started with just kind of a basic examination of your face. You said you weren't experiencing any pain.
No.
Just having a look at your cheeks, looking for any signs of external swelling. Sometimes if you have any kind of hidden infection, there will be some signs of it on the outsides of your face, but so far everything's looking good. Lips look good, healthy, well moisturized, not dry, chapped, or cracked. Okay. Can you open and close your jaw for me? Perfect. Okay, nothing notable there. So I'm gonna do a couple of palpations. Basically means I'm just gonna feel around your face a little bit, okay? So I'm gonna start up by your temples, and can I have you smile for me? Smile with teeth. There you go. Okay. And then if I can have you open your mouth, close, open, close. One more time. Very good. Have you keep your mouth closed, and I want you to swallow. One more time. Very good. Okay. Just gonna do some basic manipulation of your face here. Feeling that upper jawbone. Feeling around your gum line. Any discomfort there?
No.
Feels normal so far. Just looking out for any abnormal masses or any kind of lumps or bumps that shouldn't be there, but I'm not feeling anything. Just having a feel for your mandible. And you never have any issues with like your jaw locking or popping or hearing any noises when you yawn or anything like that?
No, I don't.
No pain as I put a little pressure here?
No.
Perfect. Okay. Just feel for that lower gum line. Okay, well the good news, James, is that I'm really not feeling anything notable on the outside. Okay, no news is good news. So let's go ahead and have a look internally. I am going to turn on my loops. They are a little bright. Is that light okay for you?
Sure.
And let's go ahead and have a look. I'm gonna have you open your mouth. Start by having a look here. Can you stick your tongue out for me? Okay, color is pink. Looks like you have healthy blood flow. I'm not seeing any abnormal discoloration or texture, so that's good. Bring your tongue kind of up towards your top lip. Okay, and underneath the tongue looks healthy. Very good. Okay. Have a look here. Look at your mouth as a whole, look at your bottom teeth. Top teeth are beautiful, nice and pearly white. Not seeing any signs of cavities. Good, okay. Gums appear to be healthy. I'm more uncomfortable just having a look inside your lips. Mouth appears well moisturized. Not seeing any signs of excess dryness. Very good. Okay. So before we get started with a little bit of a deeper exam, I'm just going to do some auscultation. So you're going to feel me do some kind of light tapping along your jawline, around the top of your mouth and down your temples. I just want you to tell me if you feel any pain, okay? Again, we're just looking for any abnormalities that might be connected to your oral health. Any pain as I palpate along your temples?
No, no pain.
Moving over to the top of the jaw. Just let me know at any point if you're feeling any sort of discomfort. Move over to the bottom. Very good. Okay. I would say you are pretty good to go to get into a more thorough examination. I'm going to make sure we're not causing you any pain there. So first thing I'm going to do is insert a bite block. This is just a styrofoam block. I'm going to have you bite down on it in various positions, and this is going to help test for the strength in your jaw. It'll also help me assess for any pain in any of your teeth, okay?
All right.
So we'll start on this side. I'm going to have you open up. Go ahead and bite down. Any pain or discomfort there?
No.
Okay, open up for me. Do that again. We're okay there. And here. Good. Good. To the middle. Very good. Very strong bite. Good. A couple more. Good job. Bite down. Good. One more. Okay, sideways. No pain or discomfort with any of that.
No, no pain.
Perfect. Very good job. All right, so I'm going to set up my basic suction here. Okay. A couple silicone tips here. I'm just going to be covering my fingers, and basically this is going to make it a little easier for me to manipulate around your mouth while I have a closer look. Okay. So, look at that lower gum line. It does appear to be pretty healthy. Brushing your teeth twice a day. And just make sure to floss regularly. It's pretty important. I am seeing a little bit of discoloration in this tooth here. Other than that, overall oral health appears to be very good. Looks like you practice good oral hygiene, which is great. Perfect. Sense for the overall texture of your teeth. Not seeing any abnormalities in the ridges. Doesn't appear to be any kind of chipping. Okay, very good. So why don't we move into some light tapping. This is going to help me test for the overall health and integrity of your teeth and your enamel. So I'm just going to do some little taps along your teeth on the top and the bottom, and I want you to just tell me if any of it causes you any pain, okay?
Okay.
Go ahead and open up for me. any pain or discomfort on the top teeth there?
No.
Okay. Let's move on to the bottom. No pain or discomfort with any of that?
No.
Good. The next thing I want to do is I'm going to shine a light on the outside of your tooth, and I want to see if I'm able to see through it. It's going to give me a sign that there might be some enamel loss there, okay? So go ahead and open up for me. The bottom looks intact. Let's try that on the top. I want to see basically if I'm able to see my metal instrument through the tooth, and it doesn't appear that I am. I'm also not seeing any signs of major chipping or cracking, which is good. Opacity seems pretty healthy. Overall, just seeing some pretty normal wear and tear for your age, which is good. Alright, James, so why don't we go ahead and move into the second portion of our exam, which is just going to be a basic cleaning. Is that okay with you?
Sure, that's fine.
So I had a look at your x-rays that Rachel sent over. There were no signs of any kind of significant damage. There are no cavities. There's not going to be need for you to have any kind of extraction or anything like that today, which is really good news. So I figured we might as well go ahead and get you in for a complimentary cleaning while you're here.
Okay.
Okay, so let's go ahead and get started. I'm going to start by let's see, why don't we start by doing a little cleaning of your gum line. So I have my section here that I'll be using intermittently to get rid of some of that excess saliva. And I just want to do basic scrubbing of your lips and your gums. This is going to help get rid of any excess dead skin or kind of food buildup or anything that might be hanging out of your mouth. This is just a little silicone scrub. Let me know if this is uncomfortable or painful. Some of that excess saliva for you. And I'm going to switch over to a toothbrush. Okay, ready? This has toothpaste and mouthwash built into it, so I feel pretty minty. This softer side has some whitening gel infused into it, so I'm just incorporating that onto your teeth. We're going to let that sit for a little bit. tops of your teeth. Good. Suction some of that out for you. Now, I'm just gonna go in and put a little bit of fluoride antiseptic in there before we go in for our scraping. Just gonna loosen up any built up tartar that you may have. So if you could just switch that around for me. Good. Okay. Go ahead and suction that back out for you. So why don't we go ahead and move into a little bit of scraping. See if you have any excess tartar buildup hanging out. Let's go ahead and open up for me. Teeth look good. I'm not seeing any black teeth. Have a look at the inside of your bottom teeth. And it does appear to be a very small amount of tartar buildup here. Doing okay, James? Okay. Not that much buildup there. I think we're okay. Maybe just this one. Good. I do just want to go ahead and go in with a flosser here. Does look like your bottom teeth are pretty tight together, so we may need to get you some spacers at some point. Do you ever have any issues with your teeth being so tightly packed at the bottom?
Mm-mm.
Just make sure that you continue to floss regularly. They do make special flossers that are made for teeth that are more tightly packed. Okay. All right, James. Well, it looks like we got you pretty cleaned up here today. The only thing I want to do is you still have some of that whitening gel on your teeth. Gonna put this in for just a second. Go ahead and close for me. Bite down. There you go. Bite. We can let this sit for about 5 minutes. It's gonna incorporate that whitening gel just a little bit. Then I'll clean you up and you'll be good to go. Okay, so I'll give that just a couple minutes. James. So it's about 5 minutes. We can go ahead and remove that. And teeth are looking good. Very white, nice and healthy, clean. And no discomfort with anything in your exam today. You did good.
Thank you.
Perfect. Okay, so ideally we'd like to see you back in every 6 months. That's about the average that I like to see my patients.
Okay.
Obviously you're new to the area, so I'm sure so hopefully we'll be keeping you around as a patient for a long time.
Okay.
If you'd like, you can meet up with Rachel at the front desk on your way out and she can make that 6-month appointment for you now.
Okay.
Otherwise you're welcome to call into the office when you're ready to come back in, okay?
All right.
All right, well, thank you so much, James. I hope you have a nice day and welcome to the clinic.
Thank you so much.